Blisters can be common for anyone who regularly participates in sports. Blisters typically develop due to friction on the skin. Most people get blisters on the heels and soles of the feet because they rub against shoes, socks, or sports equipment. This type of friction, especially in moist, warm conditions, is perfect for blister development. One warning sign that a blister is about to develop is redness and warmth on the skin, called a hot spot. Next, fluid fills the space between the top two layers of skin to provide protection from continued rubbing. When this happens, you will see a blister that looks like a little bubble on the skin. To prevent blisters, you have to minimize friction on the skin. You can do this by wearing footwear that fits and keeping your feet as dry as possible by wearing moisture-wicking socks made from synthetic blends. Other options include the taping of blister-prone toes or heels, as well as applying a non-petroleum-based jelly to reduce friction. Small, unbroken blisters that don't cause discomfort should be left alone to heal. The goal is to keep the blister from getting bigger and avoiding infection. Signs of infection include pus draining from the blister, very red or warm skin around the blister, and red streaks leading away from the blister. Any infection should be dealt with immediately by seeking the attention of your podiatrist. A contusion is basically a deep bruise that is caused by direct impact to the muscle, tendon, or ligament, resulting in the pooling of blood around the injured area that discolors the skin. Generally, the most severe type of contusion to the foot or ankle is a bone bruise. This isn't an actual break, but can be extremely painful and may inhibit movement just as a break would, and can last for a very long time. A suspected muscle or bone contusion should be brought to the attention of your podiatrist. While waiting to see a doctor, you should follow the RICE method of treatment: rest, ice, compression, and elevation. A subungual hematoma is another type of contusion caused by a crush-type injury, such as dropping a heavy object on your toe or repetitive jamming. The subungual hematoma is a collection of blood that forms in the space between the nail bed and the toenail. You will notice a discoloration of red, maroon, or other dark color beneath the nail after the injury, along with pressure and pain. If the pain is mild and the hematoma, blood collection, is less than 25% of the area under the nail, then home care is recommended, which will include ice, elevation, twice daily soaks in an antibacterial solution, anti-inflammatory medication to relieve the pressure and pain, followed by the application of a topical antibiotic and a dry sterile bandage. If the injury that causes the subungual hematoma is severe enough to cause intense pain and tenderness, or if the blood collection beneath the nail bed occupies 25% or more of the nail area, you should seek the medical attention of your podiatrist. Your podiatrist may take x-rays to rule out a fracture to the bone at the tip of the toe or a laceration to the nail bed. In many cases, the blood from beneath the nail may need to be drained to relieve the pressure. Frequently, the toe is numbed with a numbing medication such as lidocaine, which is injected at the bottom of your toe. Once the toe is numb, a device is used to burn or bore into the nail to create a hole to allow the blood to drain out. In severe cases, the nail may need to be removed. In both cases, the toenail will grow back over time, and there should be no lasting side effects.